Hello and welcome to the Parent Question Sessions. The purpose of our question and answer sessions is to provide you with an opportunity to ask questions to key professionals working across special educational needs and disability services in Leeds. These will be monthly sessions and each one will have a theme. This theme is Special Educational Needs and Disability Education. Parents were asked to submit their questions online and we will now be asking the professionals these questions on your behalf. Questions submitted have all been anonymised and will be less specific to the individuals but more generic about the services. If you have a complaint about a council service, you are able to follow the relevant complaints procedures and that information will be provided. We also advise families to check out the Leeds local offer, where you are able to find out information about the services offered across Leeds. Okay, so I am Sarah from Epic Leeds. If I can ask my colleagues to introduce themselves. Katie, please.
Hi, I'm Katie Smith. I'm one of the SEN casework team leaders in SENSAP. That's the SEN Statutory Assessment and Provision team.
Thank you. Victoria, please.
Hello, I'm Victoria Coyle and I'm the SENSAP team lead and I'm responsible for all of our children and young people with education, health and care plans.
Thank you. Karen, please.
I'm Karen Jessup. I'm Principal Educational Psychologist and I manage and lead the SEND support teams for the local authority.
Thank you. What educational options are there for children who have additional needs?
So there's a number of educational options for children and people with additional needs. Our first option for the majority of children and young people is to make sure that there is choice of an inclusive mainstream offer. Parents have told us that they want us to remove barriers to inclusion, and they've told us that they want us to support increasing the skills, knowledge and understanding of the workforce. And schools have also highlighted the need to make inclusion a really key feature of our strategy so that inclusion is strong and it meets needs most effectively in localities. And we've put that really high in the priorities around the SEND and inclusion strategy refresh. This focusing on having a strengthened SEND practice across all schools and provisions and really valuing how critical that SENCO role is, and we're putting an awful lot of work and prioritisation into that. Through the funding system, through our learning support teams and local authority, joining up our approaches with our clusters, working with CCGs to make sure that there is funding into the clusters around health needs. Our real aim is to support children and people and their families to have the choice to have their needs met in their locality wherever possible. However, sometimes that's not possible, it's not the choice of the family, and therefore there are some additional educational options which Victoria will be able to talk through with you.
Thank you, Karen. Yes, so we want to make mainstream school a real option for our children and young people. But what we're also doing is recognising that some children need an additional enhanced offer. So we want to keep that within mainstream. And so we're making, where possible, more resource provisions, as we call them, within the city. We've already got a range of resource provisions in place. We've got 10 primary and 8 secondary. Those placements support families around difficulties with hearing impairment and also for pupils with physical and medical conditions. And whenever we're going through expansions, or mainstream schools are going through expansions, we've got the opportunity to talk to them about getting more spaces, and that's what we've been doing. But we want to focus where the demand is. So we're focusing now around provision for pupils with complex communication and autism. So we've developed Beeston Hill St Luke's as a primary placement in the south of Leeds, and we've also got Bramley Primary School as well. In secondary, we're developing the Bishop Young Academy, which is currently going through consultation for a secondary provision from September 21. We recognise that, though, for some pupils, an even more specialised offer is needed. And we know that our families, like Silks, are specialist inclusive learning centres. So we're making sure that we've got enough spaces there as well. So it's good to see that we're expanding West Oaks and that the East Silk is also going through expansion. And that we've got a whole new special free school coming in a couple of years, which is going to provide many more spaces. We've also got Springwell for pupils with significant social, emotional and mental health needs. Now, for some pupils, we also know that going into any setting is very difficult. So we try and work individually to create packages to support, so that we can then work towards our children and young people being able to go back into a setting. There are some independent schools as well that are very popular, and we do support these where we can. However, the places are quite limited, and they do cost more money, so we do have to look at that individually, but we've got a good oversight of those placements, and we continue to work with the independent sector to be part of the provision for all of our children.
Having responsive, effective and consistent social, emotional, mental health support for children and young people who may have additional needs is critical to them achieving the best educational outcomes. How is this continuing to be developed in Leeds?
It's so important to support the social, emotional, mental well-being of all children and young people to make sure they can engage successfully, whether they've got additional needs or not. We want our children and young people to be happy in school, enjoy school, have friends and feel safe. The pandemic has obviously had an impact recently, and so there's quite a bit of work being done around the response to the pandemic and to make sure that we are able to support the schools to meet the needs of children and young people as effectively as possible. Whilst it's been a really difficult time, there's lots of work being done in the schools to stay connected and to see how they can manage those really extraordinary circumstances. For most children and young people on return to school, most of them have done really well. They're amazingly resilient young people, and most of the difficulties they've experienced, they've actually come back to school and it's been a really positive return. What we've been doing over the time when people have been off is working with schools to really support them to think around the emotional and social and mental health impacts and how they can support. Have a look across their universal offer within schools and see where they may need to add additional resource or have additional focus. We've had some project funding from the Department for Education, which has enabled us to do some free training that comes from the Anna Freud Centre that's really been worked across the partnership. So we've accessed support from Early Help and the Cluster and from our colleagues in health services, as well as the Learning Inclusion Service and Health and Wellbeing Service, to put the training together to make it reflective of the Leeds context. And it can also, there's some support that's going to go forward into the spring term that's going to take more of an individualised and group approach and think about some specific themes that are coming up. The whole focus for us is making sure that there is support with the workforce so that they can identify any emerging needs and we can intervene early. On top of that, the big strategy that brings this all together is Future in Mind. It's the strategy that sits with health services, but it's a real partnership approach across education, health and care. It's got our third sector colleagues. It has MindMate ambassadors. It gets feedback from family groups. It's linked in with the council. It's incredibly strong partnership that's been going for a number of years, and it focuses on SEMH needs, so social, emotional, mental health needs, from prevention to early support all the way to crisis support and transition into adult services. And it's not just focusing on children, young people at a universal level, which is for everybody. It's also making sure it's responding to the needs of children, young people who have autism, more complex needs, and particular populations. It'd be really useful to come back to talk about Future in Minds in further conversations and further question and answer sessions. And I think it would be really helpful to talk about this alongside our health and our social care colleagues, and maybe to get some further conversations and questions from parents and carers out there.
The demand for special school places for 2 to 19-year-olds has increased significantly. What are your plans to develop quality provision in post-16, particularly for post-19?
So we've already talked about the extra places we're making in our silks and resource provisions, and some of those are also included in post-16. And preparation for adulthood remains a key priority for us, and there's lots of work going on to develop this, particularly within the strategy. However, it is important to recognise it is a gap, and families need more choice, particularly at post-19 to 25. So as we're refocusing and reshaping the strategy and thinking about everything from how young people access mainstream sixth form through to learners leaving Springwell and going through to college, and also where our pupils leaving silks go, it's important to note some positive things that we're developing. There's a proposal to improve and recite the Vine to give much better quality learning for our most complex learners. We continue to work and expand opportunities for supported internships. And we work really closely with our local colleges to make sure that they're developing courses and pathways in line with what our young people want. So although there's lots of work to do, this is something that we're picking up and remains priority for us.
Families have asked how in Leeds services will meet needs for a range of different diagnoses across our most complex children and young people.
So diagnosis is a really important area for families, and it's something that can help our professionals towards those areas of need. Diagnosis is part of a health service, and whilst it draws from information provided from the parent and schools, it's within the health arena. But whilst those diagnostic routes are being explored, most children and young people who are on the roll of schools and settings already have those needs. And with the parents and carers, schools and them are working together to develop a really good understanding of the child, young person, the strengths and the difficulties, as well as what provision needs to be in place. Those conversations are going on between those closely involved with that young person to really get that nuanced understanding and see where the provision is meeting needs, and by reviewing it, figuring out if something needs to change. So all schools and settings have got a duty, regardless of whether you've got a diagnosis, to meet the needs of children and young people. And every teacher has got a duty. We say every teacher is a teacher of SEND. This is an assess, plan, do, review process. It's called the graduated approach, and it's written into the SEND Code of Practice, and it's within every school and setting across Leeds. And the aim is to develop a really strong quality plan of an understanding of what a child, young person needs to make progress in their education setting. So as the diagnostic route is ongoing, that process should be in place within school, and it's a partnership process and a partnership effort with yourselves. There's a number of teams that can help within the local authority and within the partnership, and they can support schools around how to plan an individualised and a personalised approach. And as needs become more complex, you draw from those expertise within those services, and the SENCO within the school coordinates that. In the last 18 months, we've changed our structure in the local authority to pull the SEND support teams underneath one structure, and they sit within my teams. And we're going to continuously be striving to work towards meeting the needs of children and people, not in response to diagnosis. We don't want that to be a hurdle to jump through to get service, but actually at a point to meet need. We're going to strengthen this further. We've got the SEND and inclusion strategy, where we're looking at quality planning at an earlier stage, so that if there is the need to go, or a parent wants to go through a diagnostic route, that we've got some quality information that's shared in using same language in a format that can go into support the clinicians in health services think around the diagnosis. We're also having a look at integrating our processes. We're very aware, as I said, that we don't want the diagnosis to be the thing that allows you to be a gateway into a service. And what we want to do is have a look at, whilst parents and families are choosing to go through a diagnostic route, what are the things that they actually need? What intervention and support do they need at that point in time? And we don't want to get to be in the position where we're waiting for a diagnosis that allows you to access services. So we're doing some work around that, and that's linked up with our SEND and inclusion strategy alongside the future in minds.
Are schools required to provide IT equipment to allow children to complete their homework?
Well, children are legally entitled to a device such as a laptop under the Equalities Act, but only if it can be demonstrated that it is essential for the child in order to access the school curriculum. If it's not essential, then it would be viewed as an enhancement, and that's up to the discretion of the school. If you believe as a parent it is essential rather than a desirable, then you would need to get a SEND professional, for instance, an occupational therapist, to write this as a recommendation in a formal report explaining their rationale. I think it's important to note that whilst the local authority provides schools with funding, we don't prescribe how it's spent. That's something we leave up to the educators who know their children. All we prescribe is that the funds are used solely for children with SEND and that all statutory obligations are met. If the child has an education healthcare plan, then the local authority will include that provision within their plan if it's recommended by a professional. So it then becomes a settings legal responsibility to ensure such a device is provided.
How are you integrating assessments across agencies to bring together information to form quality education, health and care plans?
So in Leeds, we don't actually integrate the assessments, but when we're doing an EHC needs assessments, families should experience transparent, coordinated approach, and they need to be part of the decision making and know what's going on. So when we're undertaking an assessment, we must make sure we're asking advice from the right teams so that we get a really good understanding and that we can write quality plans. We don't always get it right. We are improving this, but some of the good things that are happening is that we're working really closely with health to make sure we streamline things so we know which part of health to ask information for. And we are also working closely with our social care colleagues across the 0 to 25 age range to make sure we're getting their right information into our plans. So they do absolutely need to have plans that set out exactly who's getting what across education, health and care, because that's how we're going to make sure our children and young people meet their outcomes. So children can have a number of statutory plans that sit outside of an EHC plan, as well as some informal non-statutory plans, and there still remains a place for them. So for example, a child will have a child in need plan as well as an education, health and care plan. But what we're trying to do is, where possible, make sure decision making is joined up, meetings are joined up, professionals have conversations together so that we make good decisions about plans and that those plans inform each other. So although you may need an early help plan to get short breaks, even though you've got an EHC plan, it's much more joined up now. SENSAT contribute to the decision making and the resource allocation, and then we also amend the plans more with a priority, so we make sure that they get in there. So there's a lot of work going on to improve the assessment process, and we want to hear from our families about how to make it better, because we will change things if we can.
Thank you. How are Leeds working to improve the quality of education, health and care plans?
We know that education healthcare plans must be specific, clear and appropriately detailed. And in Leeds, we really strive to write plans of good quality. Ofsted criticised Leeds back in 2016 for the variable quality of its plans, and as a local authority, we agreed with that. We would say the quality had been inconsistent. But since then, we have worked extremely hard on the quality assurance process. And the result of this significant level of improvement is such that we're now confident that our plans would be deemed good at the next inspection. Sarah, you know that EPIC actually represented on the panel of professionals who oversee these efforts, and you're provided with copies of the reports that demonstrate these improvements. But that said, we believe there continues to be scope for further improvement. And also, I think what's really key is to ensure consistent, good quality plans for every child. So we continue to prioritise this work, and we do that in partnership with our advice givers, including health and social care. I suppose what I do want to say is, in terms of my advice to parents, is never accept a draft plan with which you're dissatisfied. Always discuss your concerns and request changes until you're satisfied with it. And I just want everyone to be assured that it's important to us that parents are satisfied with their child's education healthcare plan.
For some parents, when the local authority decides not to carry out an education, health and care needs assessment, it can be very disappointing and frustrating. Can you explain a little bit more about how the local authority make these decisions?
We do recognise that some parents can feel dissatisfied when the local authority decide not to proceed with an EHC needs assessment. I'd say it's not the complexity of need in itself that's the only deciding factor when making these decisions. There are many children with very complex needs who, due to fantastic efforts of very inclusive schools in Leeds, are thriving in mainstream settings without the need for an EHC needs assessment. And we must remember that all children and young people have a right, they have an entitlement to have their SEND needs met, and schools have a duty within the code of practice to meet those needs without an education healthcare plan. as a local authority, we want our mainstream schools to be inclusive and accessible. So, for instance, FFI, Funding for Inclusion, was created many years ago to separate accessing funding for SEND pupils with separating it from that lengthy statutory assessment. And that was put in place to support schools and parents to have children's needs met without the necessity of an EHC needs assessment. When making decisions regarding whether to proceed or not with an assessment, the local authority has regard to both the law, the Children and Families Act, and also guidance from the Code of Practice. Now, that decision is evidence-based, and there's a panel that make that decision, and they use evidence provided from the setting, from existing reports from professionals involved with the child, and evidence from parents. And I just want to kind of bust some myths. There's not a criteria for whether you get a plan, or whether you get an assessment or not. There's not a tick sheet. It's not whether you have a diagnosis or not. You know, we look at each individual child when we're making that decision. And, you know, in Leeds, we pride ourselves on our decision-making process and our rigor, but we don't always get decisions right. And if parents feel that and believe that the decision is incorrect, we would always revisit our rationale, particularly if there's further evidence which wasn't presented to the panel. I suppose ultimately we want to get these decisions right so that the children who really need statutory assessments get them.
For reception school places starting 2021, what support is available for parents of disabled children to help identify a suitable mainstream school for children with disabilities when we can't visit on site due to COVID?
Due to COVID, schools have had to quickly develop new and creative ways to engage with children and families. And so this year it has been more difficult for families to do what they traditionally have done and gone into schools and get a feel for what's happening in those individual schools. Many schools have got online tours this year, particularly developed for new starters in September 2020 and 2021. We've got a number of different forums where school leaders get together and they're sharing good practice with each other to talk about how they've supported the transition into school. By publishing resources, developing these online tours for all children, young people and their families. What I would say is that all the schools in Leeds, as I said before, are striving to be inclusive. And so for the most part, any school in your locality should be able to meet the needs of your child, young person. And if a child, young person has got an education, health and care plan, that has been really clearly identified within that plan, and you should be able to have those conversations still with SENCOs to talk about what needs to be in place. We've had some recent consulting support from Leeds Community Consulting, and they've produced a report for schools on how they could best promote themselves to parent and carers, and that's been shared across our school network. There hasn't been a real specific focus in there on how schools should promote the support that they offer for SEND, but there is real general advice about those videos, talking with heads and staff and children. And also in thinking about virtual tours and how they can include access to care suites and accessible toilets and calm spaces and those sorts of things. Each schools should publish the equality policy on their website, and that will provide parents of the schools about information about accessibility and SEND provision. Schools should also have had an accessibility audit with an action plan around what they currently have and don't have for pupils with SEND. But if parents are worried and they have got an additional need, SEND, I would strongly urge you to call up, speak to the SENCO, and if you're still not sure, ask if there's any other way around to do it, because I think that over the last few months, schools have learned an awful lot and they are willing to try many different things. So phone up and have the conversation again.
Thank you for joining us. I hope you've enjoyed the question and answer session that we've done today. If you'd like to be involved again in the future, we will be asking you to join our next session and to submit more questions. And it will be the SENDIAS service, which is the Special Educational Needs Disability Information Advice Support Service. So we look forward to seeing you then. Thank you very much for joining us. Goodbye.